Well, a very good morning to you, and I am coming to you from Muyenga here in Kampala, the central district of the country. This beautiful morning, of course, we're speaking about as quality health care among children and the elderly. As we speak now, of course, we know that very many hospitals are trying to find better modern ways of how the citizens in the country can access better quality health care. Where I am standing this beautiful morning is MKF Orthopedic and Pediatric Hospital in Kisugu, Muyenga, which has been introduced in the country partly to support the Ministry of Health and other health facilities in giving Ugandans quality health care. It's one of the areas that, of course, modern machinery, I can say, modern treating, technology has been introduced, and as we speak, many people are taking advantage of these. But also want to understand what this health facility is like to contribute and support the Ministry of Health in ensuring that Ugandans access quality health care. I am speaking to, of course, Dr. Mike Kawoya, who is part of the proprietors of this hospital, to just give us insights of why, first of all, from German, he felt that such services can as well be introduced in Uganda, and Ugandans get high quality health care with modern technology and equipment that is installed in this facility. Thank you so much for joining me on Morning at 10 TV.
Thank you, and good morning, everybody. My name is Dr. Mike Kawoya. I am a consultant orthopedic and trauma surgeon, and together with Dr. Froke Kawoya, we are the proprietors of MFK Orthopedic and Pediatric Hospital.
Okay. Doctor, I understand you have been in German giving this service for over 20 years. But then why did you think this has to be brought home for Ugandans to take advantage of?
We have been doing a lot of charity work over the years, coming in and out, and we noticed the need for good infrastructure in order to give good services in this country. The problem mainly is not that we have bad doctors, but we don't have infrastructure. So we decided to construct a hospital with all the infrastructure, German standard, so that we can offer that quality care that the Ugandans need.
Yeah. What is that added advantage? What is that new technology, new service that you wanted Ugandans to enjoy? Because I understand it's one of the facilities that has best machinery equipment in terms of giving service to Ugandans. What is that one unique thing you wanted to add onto the services that are being offered to Ugandans?
Basically, like you said, the technologized management. We have almost all the equipment that we need to perform surgeries. We have the technology we need to do diagnostics, ranging from ultrasound, X-ray, laboratory, into high technology theater equipment. So we are in position to give a much better treatment after doing proper diagnostics.
Yeah, of course, I read from the site that you want even the common man, they call them the common man or the lay person, to take advantage of this. But I know as a surgeon, surgeries are those concepts that are not always very cheap for a common man to always take advantage of. I've seen children from Gulu, wherever someone has a fracture, they have to get some sticks and tie around the leg just because they cannot access good health care. So what are you doing to make sure that such people are also a target for this facility to be given service?
Very first of all, like I mentioned, our journey to up to now has been charity. So we have a charity organization, Amagumba Hilfe, which is based in Germany, which helps us offer subsidized and in many cases also free treatment for children with orthopedic conditions from vulnerable backgrounds. That is one of the ways. The other way for adults is mainly, I would encourage a lot of togetherness and working together with organizations, bigger organizations, which can actually provide some funding. Some of the insurance companies are also in position to take care of the bills of the patients. So this is the way we are doing it at the moment, and we hope that this is going to be growing even more in future.
Yeah. For I have seen in some cases, organizations like, for example, I would mention the Rotary, I even see MTN sometimes coming on board to see that they mobilize the community, the less privileged, to take surgery. I don't know if you are doing any, but also making sure that the people who who are in the villages, not only people who are in Muyenga, Kampala, around the country, but even somebody from as far as Bududa, where I come from, can also get a chance to access this health care. Are you looking up to partnering with any organizations?
Well, our major partner here in Kampala is Caritas Kampala, which is the Catholic charity organization. We have been working with them from the very start, and we have been doing a very good job. So that way we have been able to treat quite a number of people. But we're also happy to go into partnerships with MTN or any other charity or a bigger organization that is happy to sponsor such camps. We would very much like to have them on board.
How does somebody get here? Do they have to get, come through an agency? I'm trying to now talk about people who are at the far ends of the country. Do they have to go through an agent? I don't know, you have a website, or how somebody can really reach this hospital from even Karamoja?
Now, the easiest way, of course, is via the website to get to know where we are, the telephone numbers, call, make an appointment, and then we shall see them. Then the other way for the vulnerable cases is via the NGOs with which we have partnered. If you approach them, and they will do the pre-assessment, and via them you can then access MFK Orthopedics and Pediatrics.
Yeah, the reason why I said this, doctor, is because you realize some of the people that need these services are not in Kampala here.
Yes.
They are the children in the villages, the islands, wherever. I don't know whether an outreach or where you can make sure you extend this service closer, because I'm sure this is the only branch you have not opened up any other. Maybe you have plans to do so or make an outreach?
Well, at the moment we are only here. And we have already partnered with a few NGOs who bring their kids here. Hands for Hope, Hope Speaks, and all these kind of organizations. They are at the moment, or even Caritas, they're bringing most of the patients. And they're the ones who have the contacts and the outreach projects out there. So via them, that's how most of the people are coming to us.
Okay, I will let you be for a time being. Let me also speak to Dr. Farouk Kawoya. Doctor, good morning, and thank you for joining One Morning at NTV.
Good morning.
From German to Uganda, what exactly do you want to offer to Ugandans in as far as how you have opened this hospital, though here in Muyenga?
Well, I'm looking at well child exams mainly. I have many requests for that from experts, but I'm still looking for some Ugandans to come for that. That is when you feel your child is perhaps not developing properly, or a failure to thrive, or also learning problems, or vision hearing problems. We have possibilities to test them from here. So I would really love to see more children, and also coming back, honestly. That's a bit of an issue, yeah. I have many families who go once here, once there, so you don't really know that child. So I would really appreciate if this idea, what we have in the Western world, let's say, that's from my background, that they come on an annual basis at least to check on their vaccines, to check on their abilities. That is actually the reason that brought me here with my husband, of course.
Of course, one of the other things I also wanted to say is that here the culture is that somebody wants to take the child to the hospital when they are sick, but they may not have to take for maybe checkup. The child is not eating well, the child is not maybe growing well in terms of, I don't know how to call it, but height and weight balancing to have the child grow, but also making sure that parents bring children for checkup, routine checkup, not only bring them when they have malaria, when they have typhoid, and the rest. Yes.
Yeah, that's the idea behind it. Of course, vaccines can prevent many of these diseases. There I also feel a need of discussion with the parents, because every child is individual, every background is individual. So I do these travel recommendations, but also recommendations when you live here permanently. So we can also prevent many diseases from vaccines. But also, once the child has something that you're worried about, it always makes sense to consult a proper, senior consultant pediatrician, and not running to a hospital at night. I can just tell from my experience, it is important that you bring the child early enough, don't wait too long. So if teachers are talking to you about that, please don't hesitate to give us a call and make your appointment, because we've already seen some cases where we could still help the child to thrive properly. But I would always advise to come whenever you feel this is the right time to check, to have a general checkup of your child. That can be any time during the year. You don't have to wait for their birthday.
Okay, for time reasons, Doctor, I want to leave the conversation here. My producer says we've run out of time, but I want to thank the two of you so much for making time to speak to us this morning.
Thank you for this opportunity. Thank you as well. Have a nice day.
Okay. Thank you so much. Well, of course, it's been an insightful conversation from the two doctors here at MKF Hospital, MFK, I mean, in Muyenga, just giving us insights on how the hospital is, of course, now giving better, advanced, technologically services to Ugandans. Of course, the whole conversation is how do Ugandans access better, high-quality healthcare? That's the conversation. But of course, more importantly, surgeries that are done here, not anywhere else, but also with a bit of technology, improved to have this given to Ugandans. This is part of the move to support the Ministry of Health in giving Ugandans good health care. We hope that the audience out there picks or borrows a leaf from this, and you can come and have some of the services being offered here. For time reasons, allow me to get the conversation back to the studios. A very good morning to you and our audience.